Hello, Yuba County and Sutter County community. This afternoon, I got my COVID-19 booster shot. And I want to explain to you my process for why I chose what I did and why I decided to even get a booster dose. So as we know, as of today, October 27, 2021, all 3 brands have been authorized by the FDA and recommended by the CDC for booster dosing. So let's talk about them one by one, and then we'll talk about my personal decision for what brand and why I chose that specific brand to get as a booster dose. So for Pfizer, it was authorized by the FDA and recommended by the CDC for those who are 65 and older, those 18 and older who live in long-term care facilities, and those 50 to 64 with underlying medical conditions to get a booster dose. The dosage of a booster for Pfizer is exactly the same as primary series, 30 microgram. The eligibility criteria for Moderna booster dose, exactly the same as what I just described for Pfizer. The only key difference with Moderna is that instead of 100 microgram of the primary series dose, you need 50 micrograms. So when you go to the clinic and you ask, you need to be specific to tell the nurse and doctor why you're there and what specific type of Moderna dose you need. Is it primary dosing or booster dosing? Because of the difference of 100 or 50 micrograms. For Johnson & Johnson, the data now is very compelling that all those who've got vaccinated for Johnson & Johnson 1 dose 2 months or earlier need a second dose, regardless of age, regardless of underlying medical condition. So I'm in that third category. Several months ago, you all saw on videotape that I got my 1 dose of Johnson & Johnson at the Habitat for Humanity clinic. And now I'm due for my Johnson & Johnson booster dose. So I could have opted for a second dose of Johnson & Johnson, or the FDA has authorized for mixing and matching. So I could have gotten Pfizer or Moderna as my booster dose. Ultimately, I chose Pfizer because of the fact that I am a female, younger than age 50, and as you all know from data that there is a very, very small risk, but not zero, that for fertile women, we have a higher risk of blood clots if we get Johnson & Johnson vaccination. So that's why I opted to choose Pfizer. Why didn't I choose Moderna? It really was about convenience. There was a leftover dose of Pfizer in the immunization clinic at Public Health here, so I did not want to waste that dose, so I opted for Pfizer instead of Moderna. But either one could have worked for me. So please go onto our website, look at the table that we share of to determine whether you're eligible for booster dosing and what would work best for you. Thank you.